she stayed with us for 2 months.
Wow.
It was, yes, very, very uncommon, but she managed to do it.
So you also mentioned that patients aged 50 plus also travel to Greece. So I'm wondering, what's the upper limit of patients that you would treat, and how is the process organized in short?
Of course, Greece have very, very pleasant rules for the patients, for the older patients. Now our authorities allowed patients from 50 until 54 years old to perform all the procedures in assisted reproduction. Of course, we have some steps because we must have the special permission from the authorities, and this permission is for 2 years every time. That before starting the process, we are preparing some official documents to the authority, giving them all the medical data of the patient, with cardiological exams, with some blood results, mammography, results from the liver level, etc. And then we are waiting about 1 month from the answer from the authority, which is absolutely positive in case that the documents are prepared correctly and the patient is healthy. And then we are able to perform all the procedures, IVF procedures, for 2 years. If we don't manage to do it into 2 years, after 2 years, we will prepare another documents for another permission for another 2 years. And this is possible until 44 years old finished.
54, is it 54?
54, yes,
Fantastic.
54.
Mm-hmm.
It's absolutely the same with another procedures based on this permission.
So why do UK patients choose assisted nature in Greece? I'm wondering what's the main reason that they come for treatment to your clinic?
Of course, I feel and I believe that we are very good and sophisticated clinic, keeping the European and world standards in IVF treatments. Our clinic was established 15 years ago by Professor Papanikolaou and me. And from this moment, we are really trying to do the best, our best in the creating facilities and, of course, monitoring all the process from beginning to the end. Our clinics, our activity is based on all very modern issues, very modern equipment and systems. We was the first clinic in Greece which used the IVF witness system, allowing all control of the samples in the lab and in all the system. We also used, of course, time-lapse equipment and clean room system in our lab. We are using, of course, air showers entering to the lab and entering from the lab. We have 2 operating theaters, with one for the pickups and another for hysteroscopic procedures. We also use microthese procedures and performing the these and microthese and, of course, the testicular functions inside the lab. And parallelly, in the two operating theaters. That in the one, for example, we are performing the pickup in the female patient, and in the second, in the same time, we are performing Tesa or micro-Tesa procedure to collect the sperm from the testis. This is also some specialization which is not common in another clinics. As I mentioned, we have a PGT-A lab and microbiological lab inside, in-house in the clinic. It's allowing us to work more properly, more detailedly, and to monitor all these steps and stages in the lab. We also working in academic level. Together with Professor Papanikolaou, our research now it's in the level over than 25 publishing articles and papers in the scientific journals during these 15 years, that we are very well known also in the field of universities, European and world universities. Our work is confirmed and very well known.
Do you remember a patient case from the UK and their IVF story? Can you tell us a bit about their medical background, IVF history?
Of course. I had a lot of patients from UK, but one of them, of course, I remember very well. It was a single woman, yes, in her 40s, and she came to us to try, of course, with egg donation, and it was very successful program in the end. It was not a very easy patient, overweight, with a lot of endocrinological problems, and we step by step managed to do and to improve these things, these stages, and in the end she came to the UA pregnant. She stayed with us for 2 months.
Wow.
It was, yes, very, very uncommon, but she managed to do it. And I remember she's a writer, yes, and she sent me her book with the dedication. Thank you very much, Robert.
Oh, so nice.
And yes, it was very, very nice, and we are in contact until now. Exchanging the cards from
time to time.
From time to time, of course, and photos from the child, how he's growing. That's a very pleasant story.
Is there anything unique in a way that you work at Assisting Nature?
Of course, I feel that we have many unique procedures and things, but the one which I would like to focus is that in every case, when we are working with the patients, we are creating the monitoring group for them. Then we have the personal assistant from the secretary, but we have also the fertility dedicated midwife for the couple, and of course their fertility doctor. And this group is working all the time together, creating, for example, if it's possible, the group in WhatsApp with the patient, with the husband, with the embryologist. And this is allowing us to control better all the information exchanging, and of course this is very, very pleasant for the patients. Patients are very, very glad to work in these groups, and they have all the time people who are really dedicated for them and know all the case from the beginning into the end. Even in the case that we are working in the stage of laboratory, they have a dedicated embryologist to inform them every day about how the progress is going in the lab. And I think that this is one of our strengths, this monitoring system and monitoring groups, giving very stable level and safety for all the parties which are working in IVF project.
That's it for today's interview with Dr. Najdecki. See you next time on IVF Off The Clock.